Good evening and welcome to HEALTHline. I'm Suzanne Whatley.
Good evening, and I am Gregory Zarian. So as always, I have a riddle me this. How active are you with your family? Suzanne?
Well, I try to do stuff with my family. I think just running around trying to keep up with their schedule, but I've got my girls in sports. They do karate and softball, and we walk a lot.
So then you're very active with your girls.
And how about you?
I am a runner. I just finished the Glendale News Press Downtown Dash 6 minutes earlier than
Yay.
2 years ago, so rock on. And when I was a kid, my father and my parents sent us boys out to play and have a good time and really be active. And unfortunately, it doesn't happen in today's day and age. Gaming is an international pandemic. It's an addiction.
There's a lot of sitting around in front of the screen, and in fact, I have to put the hammer down sometimes, and I say, okay, no more staring at a screen, girls. You're going to go outside and do something healthy.
And with obesity at over 40% of people in this country obese, and we're the most obese country in the world, these numbers are staggering to us, so that's why we're bringing you this conversation tonight, because March is Diabetes Month. It is the conversation of getting your health in order. We're emphatic about that.
23 million Americans, it's estimated, have diabetes, and it can lead to all kinds of terrible problems, amputations, blindness, even premature death. So it's a scary disease. You don't want to get it. This show is all about our mission to get you healthier as an individual and as a family.
So tonight, we have two doctors that are here to share with you how to get your health in order so that you, if you live with diabetes, what to do with it, and how to walk away from the conversation of diabetes if you don't have it. Joining us tonight is Dr. Zarmina Nakashian. She is in charge of the diabetes control at Glendale Adventist Medical Center, and also family medicine doctor, Dr. Esther Yoon. Hi, doctors.
Hello. Thank you so much for being here. Tell us, what is diabetes? Dr. Yoon?
Well, diabetes is basically when your insulin in your body that you normally produce that helps bring in the glucose into your body, you don't have enough of it, whether or not it's you're not producing it, which can be in diabetes type 1, versus you have an overproduction, overstimulation for quite a period of time, and you're not able to meet your body's needs.
So the body becomes kind of resistant to the insulin?
Correct.
And then there's also, you have diabetes type 2. What is that, Dr. Nakashian?
Diabetes type 2 usually because of the lifestyle, like people are getting more and more obese and then they're not exercising. So what's happening that they're becoming insulin resistant. So when the cells are insulin resistant, the sugar is not burned efficiently. So the person who eats the food is generating the sugar is not being utilized by the cells efficiently because the cells are insulin resistant.
When we return here on HEALTHline, we're going to be delving into this most common disease involving the endocrine or hormone system, and you could be pre-diabetic. What does that mean? We'll find out.
Hello, my name is Dr. Esther Yoon. I'm a family physician at Glendale Adventist Medical Center, and this is my health tip for your family. The best thing to do for your family is to spend time with them, and it means just unplugging and getting together with your family, perhaps playing a board game, making dinner together, just spending an extra 30 minutes that you would already have spent someplace else. Really, what I want to do as a family physician is encourage you to not only support one another, encourage one another, but also listen to one another. So in terms of family health, make it a great one.
Do you know someone who is diabetic? Well, chances are you do. An estimated 23 million Americans have this terrible disease. It can take various forms, and we've talked a little bit with our guests about type 1, type 2. Let's get into pre-diabetes with Dr. Nakashian and Dr. Yoon. Talk about the pre-diabetic state, and what kind of alarm bells does that set off?
In order for somebody to know that he is the pre-diabetic, obviously how is he going to be knowing unless he has his blood sugar checked? All right, so I have to tell you what's the normal blood sugar levels. The normal blood sugar levels are 60 to 100 milligram per deciliter. Okay. And diabetes is when the blood sugar is more than 126 milligram per deciliter in 2 occasions. All right, now if the normal is 60 to 100, and diabetes is more than 126. So what do we have in between?
Trouble.
No, I mean, yeah, there is trouble. You're right. So the blood sugar between 101 to 125 milligram per deciliter, it means that the person is pre-diabetic.
So then in regards to that, then Dr. Yoon, are there signs and symptoms that somebody will experience if they become pre-diabetic?
Or is it just the blood sugar?
So basically, there really aren't necessarily a lot of symptoms during that time, but there are just some outward signs that you might be noticing.
Such
Things
as?
like your BMI going up, which is your body mass index.
Index.
You can be obese, though not everybody is, but you're noticing that this is a time where really intervention and prevention is really important. So in that gray zone, if you will, that's a really important time for you to start talking with your physician. If you happen to go to an urgent care, or if you had some sort of a medical care elsewhere and they told you, hey, it's a little bit high, that's a time to come in so that we can discuss the options that we have in terms of controlling our diet as well as increasing the amount of activity that we have.
Now earlier, Dr. Nakashian, you said lifestyle, and I want to address lifestyle. Diabetes, is it hereditary?
Yes.
So it can be.
Yeah.
Because I have a friend. His sisters, himself, and his mother all have the diabetes where they are shifting what they're doing with medicine and lifestyle.
Yeah, it definitely can be hereditary. If you have a number of diabetics in your family, you are at increased risk for sure, and type 1 diabetes can be genetic as well. But really, what we're trying to emphasize is if you know that you have that risk factor in your family before it becomes an issue, before we get into the gray zone, let's not be in the gray zone and do something about it.
Is it more common in certain ethnicities or among men or women?
It is more common in Pacific Islanders, like Pima Indians. So there are some tribes that it is more prevalent, and but it is equally prevalent in men and women. So, but on the other hand, some tribes, yeah, it is more prevalent in there.
Well, let's dive into how we are as a culture here. I mean, lots of Armenians in our community. I'm assuming maybe a lot of diabetes or diabetic choices. How do you then talk to patients of old Armenia about getting off the starch and eating late and all the big portions and telling them this is how you have to eat so you don't end up with diabetes?
Yeah, the thing is, like this is very important issue because like cultural sensitivity. We cannot give lectures to everybody and then like a classic lecture, textbook lecture, and anticipate that people are going to be following the directions. The patients need strategies. So in other words, if I'm going to be changing,
I like that a lot. Okay.
So like the patient will say, okay, yeah, there is an issue here. My doctor told me to come and then take the classes from your treatment center, but I just cannot give books and then handouts and then talk and then let them go. I have to teach them strategies, then when they go home, they're going to be implementing it. And then so once they implement and then they establish a foundation, eventually they add to it. But I have to give the structure. Without the structure, I have to give the structure so they can do the function so that we can have an outcome. So without me giving a structure, that's it. It's useless. I have to have that cultural sensitivity.
Thank you, doctor. Don't go away. And before we come back, spend some time with our good friend, Camille Levy from Glendale Healthy Kids, how she invites you, the community, to bring your kids and your friends to the Glendale Healthy Kids Expo. Do not go away.